We've got 36 million people or more that aren't walking that should be. If this technology facilitates some of that and allows even 10 or 20, ideally we're shooting much higher than that, tens of thousands and hundreds of thousands or millions. If it allows them to get out of bed and to walk, then I would say that will have been successful. So this was Baylor's first prosthetic and orthotic center. We partnered up with a group out of patient care. We've been working on 3D printing of prosthetic devices for a long time. We're actually looking to print definitive or permanent devices for these patients. So and it dramatically changes the way in which we practice prosthetic care. So even in our offices here in Houston, Texas, we typically walk through a process that requires 10 manual labor steps. What we're doing with this project is actually addressing all of those different steps, all with a single step. So we're taking a digital image of the patient's limb and then going directly to a printed device that's permanent, that's usable in all conditions throughout the world. And the goal is actually to speed that up and to drive down the cost of that so significantly that we can meet some of the global demand. We know globally, only about 1 in 10 individuals that need a prosthesis ever have an opportunity to get it. We need to go out to where the people are. Most places in the world don't have access to good quality prosthetic care. And so 3D printing allows us to do that rapidly, at scale, with a small footprint, and with relatively low cost. We were fortunate to partner with a hospital in Uzhhorod, Ukraine, which is right near the Slovakian border. The hospital director was very enthusiastic about doing something together. It's really a testament to global health, and where it requires buy-in from a lot of different people, a lot of different entities. He took it and ran with it. He says, I'm going to support this, we want to do this. If you develop the technology, we'll help to create the space. We'll help to provide the people that you can train to be able to do this. The software that was developed for this project that we're doing in Ukraine is what I would call AI light. It picks up the scanned image, and the software itself actually creates the shape and the finished product without the need for significant human interaction and human input. What's amazing about it is we've never been able to produce a socket in the same day or within an hour of the patient coming in. So all of a sudden, it opens up a whole world for patients all over to be able to receive care quicker at a much lower cost and with a quality product that they can walk out on the same day. I think the real test of that will be what happens 5 and 10 years from now. Have we really trained individuals that can take this and run with it? How do we make sure it's not just a flash in the pan? We've had plenty of failures along the way. We've had things that haven't gone well. But it's because of those failures that we've been able to be more successful on this next round. Because we've thought about all those things, we've processed, we've worked with those different groups and teams, and they've each had things that have worked and things that haven't. And so it's packaging all of those things together that I hope will create something that's sustainable, long-term, and actually make an impact.